Hi everyone. Today we are joined by Dr. Shan Jing, a consultant plastic hand and nerve surgeon based in London, with extensive experience across UK and internationally, including New Zealand and Asia. Dr. Jing brings a sharp perspective on how surgical care and patient experiences are evolving. Dr. Jing, if you want to add anything in your introduction.
No, thank you for this beautiful introduction. I just want to say thank you. I'm very grateful to be invited into this space and to share my thoughts with you all today on a very important topic.
Definitely. So let's start with something which is very close to you. So I just wanted to ask you what are the some common concerns patient express before and after surgery?
Yeah, that's a great starter question. Look, let's be honest, surgery, even when planned, can be super daunting for patients. They often worry about pain, their recovery time, and how quickly they'll be able to get back to their normal lives. Many are also unsure about wound care and how to manage their medications, and they don't always know what is a normal symptom versus what is a red flag. And that includes the clinicians and the doctors I treat also. But really, for me, beneath it all, it's really patients showing their vulnerability. And the question they're really asking is, will I be okay? Or will someone be there for me? And so when you really can't easily navigate the whole process with someone you trust, that sense of isolation can really build in. And that can be really hard for patients.
Definitely. And how do you personally try to build trust and comfort throughout the patient journey?
Well, like any good relationship, trust really takes time. And for me, it starts with being present. So I always try to make space for all my patients and I treat them as people, not their diagnosis. From day one, I want to send out a very clear message, and that is, you matter. And I'm here for you. So I tend to speak very plainly through all my consultations and relations with my patients. I listen authentically without rushing through at all, and I make myself available, and make sure that they can reach out to me at all hours, whether it's clinic hours or not. And I do use a social media platform quite regularly for that reason. And for me, so it's about showing up consistently, not just with competence as a clinician or surgeon, but really show up with compassion and presence.
Sure. And have you noticed a shift in patient expectations or behavior over the years in your experience?
Oh, absolutely. Patients today are way more informed, empowered, more involved in their own healthcare. So they're used to getting answers very quickly. Whether it's through smartphones, devices, or AI assistants, they often do their own research. Some of it is accurate, some of it not, and that can really generate confusion. But rather than pushing back, I see my job as, guiding patients with clarity and empathy so that they feel confident and not overwhelmed with the accurate information.
Sure. So I just wanted to hear your perspectives around technology. So how has technology changed the way you communicate risk, benefits, or even procedures with your patients?
Yeah, that's a great one. So, look, we ask so much of our patients to absorb so much information in one setting. And it's no surprise that they only retain fraction of it. Studies have shown actually when presented with new information, we generally only retain about 5%. So we can't hold patients accountable when we feel that they haven't listened when this is just part of humanity. So
Mhm.
technology really allows us to change all of that. So instead of like one rush explanation, I often try to follow things up with, a voice note or a short video or visuals or sending patient leaflet that can be delivered directly to their devices after consultation, and really allows patients to have time to really reflect and revisit the information and ask questions in their own time. And for me, that has really helped to improve their understanding, turns really what is a consenting process into a real time informed decision making.
Definitely. So let's talk about AI. So what do you think uh, is the role of AI, and what role AI can play in setting more realistic expectations for procedures.
Yeah. So for me, AI guides patients step by step from pre-operative to post-operative care, and again through various modes, that being voice, visual, or even short animations to keep the patient up to date. It really can deliver patient information through a very personable and digestible way because we're all built differently, we all think differently, and we believe things slightly differently. So it's really helping to engage patient in a very bespoke manner. Um, and if someone seems confused or overly optimistic, I'm hoping that AI in the future can really flag that up and really prompt a human to human follow up discussion. So it's not about replacing care. It's about helping people feel prepared and genuinely supported every step of the way.
Yeah, understood. And let's talk about impact. So I just wanted to hear your perspective on what kind of impact do you think AI can have on plastic surgery?
Yes, I think it's a great question because I think plastic surgery is deeply personal to every patient and every detail matters. So, whilst I don't think AI is going to replace, my hands or judgment anytime soon, well, hopefully not
Mhm.
anyway, I'll be out of a job otherwise, but it can really support us in a very meaningful way. So, for example, the advent of Google Camera has allowed clinicians to make earlier diagnosis to identify things, for example, like skin cancers. Really, also, it can show realistic outcomes through visual simulation and with before and afters. It can also allow us to really stay engaged with our patient across long recovery. So, being able to answer questions, flag any concerns, and also offer reassurance.
Definitely. And are there any areas that you think AI might support plastic surgeons more meaningfully?
Oh, definitely. We've seen a rise in clinician burnout and, patient loneliness. We are living in a world, despite in hyperconnectivities through internet and social media platforms, we are living in a world of a loneliness epidemic, unfortunately. And both are made worse by fragmented communication. So I see that AI can really help by, handling the routine that's triaging calls, escalating urgent concerns, and even assisting in documentations. And that would really free us the time as clinicians to focus on the real art of surgery and human care. But there's more. AI can also act as a bridge, connecting patients with their loved ones, providing emotional support, whilst either before or after appointments, or even sometimes during appointments. Um, Humans are social creatures. We are social creatures. So it's about building meaningful relationship throughout that process. And sometimes that can make all the difference.
Yeah. So there is a lot of buzz around AI replacing the human touch. So I just wanted to hear your perspective that how can we ensure that AI enhances rather than replaces the human connection.
Yeah. So for me, it's about designing with intention. AI should support clinician, but not replace them. So right now,
Mm.
it lacks the clinical judgment, the creativity, and the emotional intelligence or nuance needed to manage, complex or unpredictable situations, which I have been, and like many surgeons, been trained to do. Um, but so it's about knowing that it has limits and build it with limits, really. So when
Mm.
used responsibly, and that's really important, AI can really clear the space that really builds more meaningful human interactions, not less.
Definitely. So, in 5 years, what would be an ideal tech supported patient experience looks like to you? I just wanted to understand from your perspective that if you have to design a patient experience, like a tech enabled patient experience, what would it be?
Yeah, so personally, I can really imagine a single intuitive AI companion that is tailored to each patient that stay with them from consultation to full recovery. So
Hmm.
something I used to joke with colleagues in the past, which I believe might turn into a real reality, is this futuristic vision of a hologram of me popping out from a device which patient can access, 24/7, have open access to me, and answering really basic common questions that are asked by many patients, sends reminders, monitor their symptoms and any red flags so that it allows me to connect with my patients immediately and sort the problems out in real time, and really listen to their concerns. So that's how I see that we can elevate patients' experience. Actually, it's not just for the patients, but also for the clinicians also.
Definitely. Well, thanks, Dr. Jing. It was great speaking to you, and you shared really great insights. Any last thoughts?
Well, look, the pleasure is all mine, really. So thank you for inviting me to this space. And I'm really excited about the future of AI and technology in healthcare. So, watch this space. It could really revolutionize how we actually deliver patient care.
Definitely. Thank you so much.
Yeah. Hopefully, we'll do another interview again with my avatar or hologram.
Definitely. Yeah. With
Thank you so much, Jitin.